Hi, I'm Dr. Asha Devereaux, and I'd like to briefly discuss the topic of turmeric, myth or magic. During this session, we'll discuss some of the pros and cons of turmeric use, what it is, and some potential benefits. As with every presentation, I have no conflicts of interest on this topic that we will be discussing. I have received support from my terrific patients whose clinical questions will frame our conversation today. So, how did I get into this niche of integrative medicine? After completion of my training and serving 11 years in the Navy, I was trained to follow the book of medicine. However, many of my patients were always asking, is this supplement okay for me? And following research answering their questions, I discovered that those patients who took an interest in using food and exercise as medicine tended to be more resilient. And throughout this process, it led me to receive board certification in integrative medicine. So now I try to incorporate information with Western medicine as much as possible in any of my recommendations for my patients. First of all, I'd like to talk about what is complementary and integrative health. Due to public interest, there's a little bit of background. In 1992, the Office of Alternative Medicine was established by the National Institute of Health, but this is now called the National Center for Complementary and Integrative Health. The term alternative has been removed. And the reason is alternative is considered complete absence of Western medicine in care plans, whereas complementary means that folks are working with current Western medicine to complement their care. In the US, it is estimated that 38% of adults, about 4 in 10, and 12% of children are using some form of complementary therapy, and 60% of people with cancer take 2 or more dietary supplements daily. That translates to over 80 million people spending approximately $30 billion on complementary therapies, which equates to 9% of total out-of-pocket healthcare costs. And this number is anticipated to grow to $60 billion. Of the $30 billion in complementary and alternative medicine in the United States, nearly 40% is for allergy and asthma. And it isn't uncommon to go to a grocery store and find aisles of herbs and supplements. And it's very difficult to realize what is healthy for you, what you can choose, and what would benefit you. The integrative approach has a formal definition. In healthcare, we have gotten away from seeing the patient as in a holistic manner. We think of them as a disease or a billing code or a box to check. Patients are a complex multitude of stressors, diseases, conditions, temperaments, beliefs, habits, and backgrounds which need to be factored into our delivery of medical care today. Patients are vulnerable and crave the whole body-mind interaction with their providers. It is getting harder to connect through a computer screen, which is a major factor in physician as well as caregiver burnout today. So the integrative approach is a whole person and inclusive of a family approach, healing-oriented, not necessarily disease-oriented, but definitely focuses on the manifestations of the disease. Patient, physician, and clinician partnership includes mind, body, spirit considerations, as well as the patient's belief system. It's holistic in approach, multi-level, and multifactorial. This is something that I've created in part of our pulmonary literature, and as my role as a co-chair for the American Thoracic Society's Integrative and Therapies Work Group. And this is something we put together to help our fellow pulmonologists and folks in respiratory medicine understand the integrative approach for pulmonary diseases. And I like to look at this with mindfulness and meditation as central, where the brain would be in the schematic of the lungs. And then look at breathing exercises, movement such as yoga and Tai Chi, supplements and herbs, food as medicine, acupressure, massage, acupuncture, and Ayurvedic medicine and Chinese medicine is at the core, because many of what we talk about originates from ancient forms of medicine and healthcare, of which turmeric is one, and we'll be talking about in further detail shortly. So this is a slide from Dr. Bharat Agrawal, who is at MD Anderson Cytokine Research Section studying transcription factors in cancer prevention. Based on his work in the early 2000s, he postulated that nuclear factor kappa beta activation is a major cause of inflammation, and that suppressing this mediator may help reduce cancer or the inflammatory process. There are things such as cytokines, stress, infections, cancer, tobacco, hypoxia are all activators of this nuclear factor that we all humans possess. And this then can block cell death, which then alters our tumor expression and proliferation in the body. So it is now becoming well known that inflammation leads to cardiovascular disease, may be implicated in Alzheimer's as a secondary product, with diabetes, is definitely involved in arthritis and autoimmune diseases, as well as many pulmonary diseases. Of the many supplements and herbs that affect lung health and overall health, let's focus today on turmeric, of whose major component is curcumin. In December of 2018, I was asked to talk about foods that can fight lung inflammation, and want to draw your attention to a Reader's Digest online article that was published if you want any more information on that topic. So, about turmeric, it originated in India mainly from ancient Eastern cultures back in India, and it dates back 4,000 years in the Vedic culture. And it was documented as medicinal to alleviate effects of poisoned food. Turmeric then migrated to China around 700 AD and Africa around 1200 AD. In 1280, Marco Polo marveled that turmeric had qualities similar to saffron. Due to its high content of bioactive curcumin, Indian turmeric is considered to be the best in the world. There is a city in South India known as Yellow City or Turmeric City, or textile, another city called Erode, which is the largest producer of turmeric. India produces nearly all of the global supply of turmeric and consumes nearly 80% of it. So many people recognize turmeric as a yellow powder, but turmeric actually is a root product similar to ginger. The term turmeric derives from the Latin word terra merita, meaning meritorious earth, due to ground turmeric resembling a mineral. In French, it is known as terra merita, which is called yellow root. It has also been used medicinally for over 6,000 years, and there are as many as 133 species of curcuma identified worldwide. Requires warm weather and a lot of rainfall to thrive. It is often dried and ground and used as a cooking spice, as many of you know. In 2014, in the US, 12 million pounds of turmeric was imported. Curcumin is the phytochemical that gives turmeric its golden color. It is responsible for most of the therapeutic effects of turmeric and is considered a polyphenol as an antioxidant. Curcumin is found in the plant rhizome, or the root, which belongs in the ginger family. I've included a picture of cumin, which is a different product and does not have any medicinal properties. Cumin is a small seed that is also used in Indian cooking, but it differs from turmeric, which is a root. Between 2013 and 2014, turmeric was the best-selling herb and supplement in the United States and can be found at many warehouse stores in large quantities. The composition of turmeric is 9% moisture, 6% curcumin, other oils, madder, and mold. Turmeric is also rich in potassium and mainly consists of fiber. It is a good source of omega-3 fatty acids and alpha-linoleic acids. In Asian countries, consumption is approximately 200 to 1,000 milligrams a day. That's approximately a quarter teaspoon. 1 tablespoon of turmeric powder has 29 calories, almost a gram of protein, lots of carbohydrates, but very little sugar. In South Asia, dietary consumption is, as I said, about a third of a teaspoon. However, in India, up to 8 teaspoons has been shown to be safe when consumed. There is very low bioavailability of turmeric, or its active form, curcumin, from the gut. Studies have shown that if you combine turmeric with black peppercorns, it facilitates blood flow to the gut and therefore enhances absorption of the curcumin. That is why often you will find in supplements they've mixed it with black pepper. In recent years, curcumin has been studied for its effects on chronic diseases such as diabetes, Alzheimer's, and cancer. Overall, cancer rates for women were lowest in India and more than 180% higher in U.S. whites. Studies have also shown benefit in decreasing joint inflammation, equivalent to 1 tablet of a 400 milligram ibuprofen, or as a dental salve in alleviation of oral, what we call mucositis, or inflammation in the gums. It's been used historically topically on wounds and to alleviate cough and congestion. It is found in a variety of forms and, interestingly, is now one of the most common natural colorants for foods like ice cream, in cheeses, and, in fact, in Kraft macaroni and cheese. Studies trying to quantitate how much is beneficial depends on the reports of dietary intake in India. Here is one of the pictures that I often show patients, and this is using asthma as an example of inflammation and how a variety of stressors can lead to inflammation in our GI, in our body. But interestingly, a high-fat diet, and here it is, French fries, can also create a systemic inflammatory response. And this is what we are trying to address with turmeric. And here's a schematic of what I described to you in an earlier slide regarding nuclear factor kappa beta. As you can tell, it is theorized that nuclear factor kappa beta is suppressed by curcumin. With the blockage of nuclear factor kappa beta, then you won't have release of so many different inflammatory mediators and perhaps decrease inflammation. It's a simplified way to look at this slide. Here's a schematic of an animal study showing how curcumin acted in a rabbit muscle. Of note, a lot of the studies we have on curcumin, as well as many supplements, are done in the lab on animals or in what we call in vitro cell cultures. It is very, very difficult to assess dietary supplements in large populations and to see if there's an effect, as many people are exposed to so many different things. But nowadays, there are increasing amounts of studies on what we could call food science. And so I anticipate there will be more rigorous randomized controlled trials. So the curcumin is theorized to act as an anti-inflammatory agent by a variety of mechanisms. One, by inhibiting what's called COX-2 inhibition, which is in the inflammatory cascade, as well as inhibiting nitric oxide synthetase and nuclear factor kappa beta. It also decreases in new blood cell growth, which is what cancer cells use to feed itself and metastasize. And it also will block vasospasm. And here is a great example of that. If you see on the left-hand side, this rabbit intestinal muscle where it is rapidly firing, and you give it some curcumin, and within 0.3 of a second, it has decreased its activity of firing. However, and very similar to a drug called verapamil, which is a calcium channel blocker. Here's a list of conditions that currently are proposed to be impacted by curcumin in a variety of different manners. So note that the number of nuclear factor kappa beta signal activations seems to be very common as a pathway for many of these disease impacts. As mentioned before, many of you wonder, is the cancer incidence in the US versus India different? And by population studies, there have been noticed to be some decrease in incidence per 100,000 population in prostate cancer, melanoma, colorectal cancer, endometrial cancer, lung cancer, bladder cancer, breast cancer, and renal cell. However, we have to factor in that diet is also very different in these countries. And so we cannot attribute turmeric alone as the main factor in this cancer incidence. So let's talk about a couple of specific things that we have noted with turmeric and cancer. Phase 2 trials have shown doses as high as 8 to 12 grams per day is tolerated with chemotherapy. It has been implied in helping increase survival for patients with pancreatic cancer, and that there has been one study showing that curcumin plus a chemotherapy increases survival in certain leukemia, CML. Studies are currently ongoing in other cancers. How does turmeric impact cancer? Well, as mentioned earlier, it disrupts angiogenesis, which is the growth of blood cells that the cancer can form. It also inhibits some growth factors, and it interrupts cellular division, and it decreases the tumor-associated inflammation that nuclear factor kappa beta triggers. So this is considered providing an additive effect to some cancer regimens. A very exciting area is turmeric in alleviating symptoms of arthritis. And this was a fairly detailed meta-analysis where they looked at all the studies on turmeric and arthritis. And what they noticed that there's a trend. If people are using turmeric, they had a decrease in arthritis pain symptoms. However, many of these studies that they also reviewed showed that the effects were neutral. They found that a turmeric extract or curcumin extract of 1,000 milligrams per day was equivalent to about one nonsteroidal anti-inflammatory tablet. More rigorous and larger studies are needed to confirm the therapeutic efficacy of turmeric for arthritis. The quality of the studies were not consistent, and some of the conclusions couldn't be definitive. Of the 10,000 articles, only 8 qualified as randomized controlled trials. Regarding atherosclerosis or hardening of the arteries due to cholesterol and plaque, curcumin has a strong capacity to prevent what we call lipid peroxidation, which is in what turns cholesterol into more of a toxic inflammatory mediator in our arteries. It inhibits proliferation of those smooth muscle cells so that the lining of our blood vessels and smooth muscles don't thicken up. And it decreases the platelet aggregation, which means it decreases the stickiness of our blood. And some animal studies have shown that a supply of curcumin, as well as capsaicin and garlic, fed to rats within a cholesterol-enriched diet prevented an increase in the membrane cholesterol, and it significantly prevented early atherosclerotic lesions in the chest compared with other animals that were fed this high-fat diet without any curcumin. There have also been studies done in diabetic animal models. And because of these diabetes implications, many diabetics are being advised to add curcumin or turmeric to their diets, because after induction of diabetes in rats and mice, and then addition of curcumin, after certain numbers of days, they were found to have some some glucose lowering effect. It may help, more ideally, prevent secondary effects on coronary arteries, the pancreas, and the kidneys. And some of the studies imply that it may decrease the effect of the sugar in the retina and decrease diabetic retinopathy. However, we do need more studies. Now, turmeric and the skin. There have been some studies, and many people are using it to reduce acne, decrease facial hair growth, and improve the complexion. There have been studies showing that it benefits those with psoriasis and of questionable benefit in use in skin cancer. In India, it is in Ayurvedic medicine, it's been very common to mix turmeric and apply it to the wound to promote wound healing. And they apply it in the villages to postpartum women at the umbilical cord. It does have antifungal and antibacterial properties. However, with all of this turmeric that we've been purchasing in the United States, there is a downside, and one is lead exposure. This study is a report that came out in 2017 describing the events around children being exposed to lead. And they noticed that the kids were coming in with high levels of lead, and they couldn't figure out why. And they found it was originating from ethnic grocery stores. And we'll talk about that in a little while. But there are other risks regarding turmeric. Contact dermatitis can also occur where you could get itching or a rash on the skin. There is a drug supplement interaction with vitamin K, some blood antihypertensive or blood pressure medications, and it may prolong the activity of an immune suppressive called tacrolimus. Turmeric definitely causes some yellow skin discoloration if you touch it, and this can last a few days, but it does go away. Nausea, diarrhea, as well as dyspepsia or reflux are known side effects of turmeric ingestion. And here's a picture of just a woman who had cooked with turmeric and the yellow discoloration of her hand. So here's what I had alluded to before on that study regarding lead toxicity. Of 32 turmeric samples purchased between 2011 and 12 in Boston, nearly half had more than the maximum allowable lead for candy, which is the only standard we have because no standard for lead exists for food or spices. Of note, ethnic markets had the most, especially in Bangladesh. So since that time, the FDA has issued alerts on certain brands of turmeric being imported, and none is permitted from Bangladesh. And upon further reading, the thought is that lead was being added to turmeric from Bangladesh to increase the weight of the product because turmeric is sold by weight. However, studies have also found that in the fertilizing process in India and Bangladesh especially, they had leaded contaminated their fertilizer, and that is considered a source of the lead in the turmeric. Now, in terms of essential oils, many people are talking about that. There are antifungal properties, anti-mosquito, anti-venom, antioxidant. It's considered neuroprotective. However, ingesting this concentrated oil should be avoided. because it can cause anemia, liver failure, and the doses can get quite high. So if you are going to consume turmeric, it may be better to consume as the powder or in a controlled supplement. Here is just a snapshot of the variety of different forms of turmeric that are available today in your stores or online. It also comes in the liquid form as well as quote-unquote golden milk. And as you can tell in the corner in the lower right hand, it's also used to lighten scars and pigmentation. However, with the yellow discoloration, I question that. And notice in the center, turmeric is sold with black pepper, and that is due to enhance the absorption in your system. One thing to keep in mind that turmeric supplements or even a meal that had turmeric in it can't combat a bad diet. And in fact, none of the complementary or integrative therapies can combat a highly inflammatory lifestyle or diet. So that is why I like to approach everything as food as medicine, and had in our lectures, in our face-to-face lecture, had provided some different forms of turmeric for folks to touch and taste, and many of you have asked me for recipes. The things that we had at that session were cauliflower and potatoes, commonly called aloo gobi at an Indian restaurant, some plain basmati rice, a turmeric pickle that I had made, and some store-bought chutneys. I'd also snuck in some turmeric into some fresh passion fruit, added it to water with some ginger and honey, and many folks had enjoyed it. So here's the recipe for the cauliflower and potatoes, or aloo gobi. And what you do is cut one head of a cauliflower into little bite-sized florets and chop 2 to 3 potatoes into similar bite-sized squares. Chop an onion and then set that aside and saute about a teaspoon and 1 to 2 teaspoons of cumin seeds, a dried red chili pepper, in some vegetable oil. As the cumin seeds sizzle, then add the onions, and then onto the onions, saute them until they're about translucent, and then add some ginger garlic and saute that for a minute. Add the cauliflower and potatoes, followed by all of the powdered seasonings, except for the last 2 ingredients, which is the garam masala and some cilantro for garnish. Mix everything together, turn it to low to medium heat, put a lid on it, and let everything cook together. You may need to stir it a couple of times while cooking, and maybe put a little water, maybe just a few tablespoons of water so that the potatoes don't stick to the bottom of your pan. And when the vegetables are done to your taste in terms of softness, you can turn off the heat, stir in the spoonful of garam masala, and top with cilantro, and you're ready to serve. When making this turmeric pickle, I recommend wearing kitchen gloves, as turmeric stains everything yellow, including the cutting board. So when using turmeric as a root, you can find this at many of your grocery stores now. Just cut off the brown peel and slice them into small, thin, almost like matchsticks, a little thicker than that. Grab a jar, put it in a jar, and with 1 cup lemon juice, 6 to 8 garlic cloves, 6 to 8 green chilies. I use Thai chilies, salt to taste, and then put it all together and shake. Add a little water and just put it in the fridge, and after about a week or 2 it will pickle and makes a kind of a tasty little bite-size turmeric, which has a lot of fiber and nutrients in it. And it's very common to serve this as a complement to many Indian dishes just on the side as a crunchy accompaniment. And that concludes the presentation on turmeric. If you have any questions, please don't hesitate to email me or call me, or we can talk about it at the next time I see you. Thank you very much and have a nice day.